Joining us now is Dr. Hooman Khorasani, dermatologic and cosmetic surgeon, to teach us how we can protect our skin. I love how we also say this is very preventable. So let's start with step one. What should people be doing?
Thank you for inviting me. Like you said, more skin cancers than any other cancers combined in the U.S., but it's also most preventable. So what do? Number one, sunscreen.
Yeah.
But not only sunscreen, but we have to also make sure that we apply it frequently. So every 2 hours when you're just walking around, and every 30 minutes when you're swimming or you're active. So it's very, very important.
Now, people get kind of caught up on this sunscreen's bad for you, this one's good for you, and there's a lot of talk about that right now. So what would you tell people?
So I personally like physical blockers. They tend to be safest, also safer for an environment. Anything over 30 is usually good. People are really critics of sunscreen. They say that, it gives you a false sense of security, that if you're just using a little bit of a sunscreen, you can be outdoor and you're like invincible. So that's, what you have to understand, that also protective clothing is really important. Large shades, a wide brim hat, and UV protective clothing.
So tell us, what exactly is skin cancer? Because any cancer is just a multiplication of cells at an abnormal rate, and there's nothing you can do to stop it. So what does it look like when it happens on the skin?
Yeah, so it's uncontrolled growth of skin cells caused by UV damage, usually by sun or tanning beds. Usually, it depends on the type of skin cancer. Basal cell is the most common one. Is
that what we're looking at? I was going to say, that's probably not up on the screen, though, but on the screen.
That's it. So that's a basal cell carcinoma. Looks like a pearly papule. It looks like a pimple that doesn't go away.
Wow.
So that's the most common type of skin cancer, but least aggressive of all of them.
Now, is there something, okay, so this one obviously looks a little bit more aggressive.
This is a squamous cell carcinoma. Usually looks like a patch that keeps bleeding or flaking. So somebody just keeps shaving one spot, keeps bleeding. And that's squamous cell carcinoma. Is the second most common type of skin cancer. But only about 10% of them can be dangerous. And this one, last one, is melanoma. So melanoma is the least common type of skin cancer, but is the one that is most dangerous.
So you have to look at a mole on your body and to know that that's normal and that's not normal. Like, what are you looking for to make sure that you need to go to doctor?
Keys change.
Okay.
So anything that looks a little bit off, anything that's changing, you need to get it checked, see a dermatologist, have it biopsied. We talk about A, B, C, D, E's of melanoma. A stands for asymmetry of a mole. B stands for irregular border. C is for color, so different shades of brown or black within the mole.
Yeah.
And then D is probably very important also, like diameter, anything over 6 millimeter.
Okay. Oh, good point.
And E, evolving. So again, looping back into change. So anything that is changed on your skin, you need to be vigilant. You have to bring it up to your dermatologist, have them examine you, and have it maybe even biopsy.
Well, I know a lot of people watching have not gone to see their dermatologist to check up all their moles. So where can people come find you if they want to stop by and make sure that they're good to go?
Yeah, absolutely. I'm on 135 Fifth Avenue. And I would be delighted to see anyone, but also there are many, many free skin cancer organizations that are providing screening for free. Skincancer.org is a very good source. People can go and log on there and look for like a free skin cancer screening.
That's great. Okay, well, thank you so much, Dr. Khorasani. Really appreciate you being here, especially as we head into the warmer months.
Bianca, thanks for having me. I appreciate it. Very nice being here.
All right, we still got more of the noon straight ahead. Stay with us.